Hi everyone, welcome back to my channel. Today we are going over some practice questions about the integumentary system. These questions will help you learn and get better at medical coding. I'll explain each answer step by step so it's easy to understand. If you find this video helpful, please like, share and subscribe to support the channel and get more videos like this. Let us start with the first question. We'll check the options first. That is option A and B 10120 and option C and D 20520. The code 10120 is for incision and removal of foreign body, subcutaneous tissues, simple, and 20520 is for removal of foreign body in muscle or tendon sheath, simple. Now let us read the question. A patient presented with a superficial foreign body in the left ring finger. The physician applied local anesthesia, made a simple incision in the skin overlying the foreign body and retrieved the foreign body using hemostats or forceps. What is the correct way to code this service? So we already checked these two codes. So which code is correct? The correct code will be 10120 because it is used for incision and removal of foreign body. It matches the scenario. The physician made a simple skin incision and removed a superficial foreign body using forceps. We'll eliminate option B and D with the code 20520. The code 20520 is for removal of body in muscle or tendon sheath. So, muscle or tendon sheath is not mentioned in the question, right? Therefore, we cannot code 20520. Now we are left with option A and B. In option A, they have given the HCPCS modifier F3 and in option B, they have given F8. You can find this in your CPT manual also, that is inside front cover. F3 is for left hand fourth digit and F8 is for right hand fourth digit. In the question they have given left ring finger, which means left hand third digit. Therefore, we have to use F3. The right answer is option A. Let us move on to the next question. Check the code in option A 11740. It is for evacuation of subungual hematoma. Check option B 11719. 11719 is for trimming of non-dystrophic nails, any number. And option C 11760 is for repair of nail bed. Option D, none of the above. Let us read the question. The patient comes with the subungual hematoma. The physician drained the hematoma. So, they are asking what is the correct CPT code for the service provided by the physician, that is draining the hematoma. So, what is the right answer? It is simple. The right answer is option A 11740, which is for evacuation of subungual hematoma. We'll eliminate option B because it is for trimming of non-dystrophic nails. That is not mentioned in the question. And option C 11760 is for repair of nail bed. That is also not mentioned. Option D is also wrong. The code 11740 is for evacuation of subungual hematoma. This code is used when a physician drains a hematoma. That is collection of blood under the nail, which is exactly what happened in this case. Therefore, right answer will be option A. Next question. Which of the statement is incorrect regarding the excision of benign lesions? Option A, excision is defined as partial thickness removal of lesion including margins. Option B, the margins refer to the most narrow margin required to adequately excise the lesion based on the physician's judgment. Option C, excision includes simple closure when performed. And option D, repair by intermediate or complex closure should be reported separately. So here they are asking which statement is incorrect among these regarding the benign lesions. The incorrect statement here is option A, excision is defined as partial thickness removal of lesion including margins. You can find the correct definition in your CPT manual under excision of benign lesions. Excision is defined as full thickness removal of a lesion including margins and includes simple closure when performed. Please highlight it. In the same paragraph, you can find other guidelines also. That is option B. The margins refer to the most narrow margin required to adequately excise the lesion based on individual judgment. And they have given option C. Excision includes simple closure when performed. And also option D. Repair by intermediate or complex closure should be reported separately. So, the statements B, C and D are correct. The statement in option A is incorrect. Next question. In option A, B, C and D, there are two codes, that is 11200 and 11201. So let us check these two codes. 11200 is for removal of skin tags, multiple fibrocutaneous tags, any area up to and including 15 lesions, and 11201 is the add-on code which is for each additional 10 lesions or part thereof. And we can use 11201 in conjunction with 11200. Let us read the question. A surgeon removed 17 skin tags from the trunk of the patient, and they're asking what is the correct way to code the service. So here there are 17 skin tags. The code 11200 is for removal of skin tags up to and including 15 lesions, and 11201 is for each additional 10 lesions or a part thereof. So the right answer will be option D, that is 11200 and 11201. Because the surgeon removed 17 skin tags, 15 is covered by 11200 and 2 additional is covered by 11201. Okay. In option B and C, they have only given 11200. We cannot code only 11200. In option A, they have given 11200, 11201 with modifier 51. We are not using modifier 51 in this scenario because modifier 51 is for multiple procedures. But 11201 is an add-on code which should not be reported with modifier 51. Okay? The right answer is option D. Next question. This question is related to guideline. Which of the following statements is incorrect? Option A tissue block in most micrographic surgery is defined as an individual tissue piece embedded in a mounting medium for sectioning. Option B, the Mohs surgeon removes the tumor tissue and maps and divides the tumor specimen into pieces. Option C, each piece is embedded into an individual tissue block for histopathologic examination. Option D, all the statements are correct. Now, to find the answer, we'll see most micrographic surgery guidelines in your CPT manual. You can see that a tissue block in most surgery is defined as an individual tissue piece embedded in a mounting medium for sectioning. The statement in option A is correct. Now, let us check the statement in option B. You can see in the guidelines they have given, the Mohs surgeon removes the tumor tissue and maps and divides the tumor specimen into pieces. So that is also correct. The statement in option B is also correct. Now let us check the statement in option C. Each piece is embedded into an individual tissue block for histopathologic examination. That is also present in the guidelines. So all the statements A, B and C are correct. Therefore, the right answer will be option D. All the statements are correct. Thanks for watching. I hope this helped you learn something new. If you enjoyed the video, don't forget to like, subscribe and share with others who might find it helpful.